Welcome back, everybody, to a Better Day podcast. My name is Katrina. Thank you for joining me. And I have Leslie here in the background.
Hello, everyone.
Thank you, Leslie. Nice to see you.
To see you too.
And today, we talk about tools and resources and real life stories that, on this podcast, and it helps build stronger communities. We talk about how to create better mental health and brighter futures. And today we have the pleasure of having Horatio back on. He was on the last podcast. If you didn't listen to that, I suggest you go back and make sure you listen to that first. But today we're going to dive into something that affects millions of Americans, especially those navigating the healthcare and the recovery, aging, or even supporting loved ones. So let's talk about Medicare, specifically A, B, C, and D, which, by the way, there are more. I just learned this. I wasn't familiar with any of that. So how are you?
I'm doing well. First of all, thank you guys so much for having me. It was a pleasure. I had a blast the last time. So thank you for inviting me back.
And you came back for more.
I came back for more.
Well, I appreciate it. Thank you for coming back. So can you break that down for us? First, tell us again, Medicare specifically. What is Medicare?
So Medicare is a federal government-run health insurance for every American citizen.
Okay.
As long as when you worked and you paid your taxes, a portion of that gets taken out into Medicare. You see it on your paycheck stubs every time. Okay. When you turn 65, you qualify for it on your birthday. You qualify 3 months before your birthday, 3 months after your birthday. That's your initial enrollment period window. Okay. So there's Part A, there's Part B, which is what most people are familiar with. Part A covers hospitalization. So if you're enrolled in Part A, it covers you for hospital visits, emergency room visits, mental health emergency visits, and even urgent care centers as well. And Part B covers you for doctor's visits.
Let me back up here for a second. So that Part A, it covers like the hospital visits and nursing cares?
It covers skilled nursing facility. Thank you for catching that.
Hospice? What about like home health care?
It does cover some home health care. It covers some home health care, but there are some limitations as far as the time that they would approve for a patient in their own home, as far as providing help and with nurses. But if you're in a skilled nursing facility, it covers a lot more, but it still doesn't cover everything. Okay. It covers, I think, don't quote me on this, I think it's like 160 days maximum or something like that. I'll fact check and come back around to you later on that one.
Okay. And since we deal a lot with those who are in recovery for substance and alcohol use, I'm sure, I want to know, does it cover any of that, those stays inpatient as well?
100%. 100% those are covered, especially if you're getting preventative care for that. Like, that's definitely something that's always covered for every Medicare plan.
Okay, great.
Absolutely. Counseling is also covered as well, too. Yeah.
Under A?
Yes, 100%.
That's wonderful. Well, thank you for that information.
No problem.
Okay, sorry about that.
Good questions.
Right?
Keep them coming.
Well, I learned from last week, which is why I said, if you did not listen to the first podcast with him, make sure you go back and listen to that first. Okay, so Medicare Part B.
Medicare Part B now, what it covers doctor's visits, outpatient care like same-day surgery or x-rays. It covers preventative services like screenings, vaccines, even counseling, durable medical equipment like a wheelchair, like a walker. I don't know if it covers the tennis balls that a lot of people cut and put on the bottom of the walker, but I'm gonna have to find out about that.
You mean that doesn't come with the walker?
I'll let you know when I get there. But yeah, those are the things it covers. It also covers some health services as well. We can get into that in detail some other time. Okay. But yeah. Those are the things it covers. And the most important thing is that it covers like your doctor's visits, because visiting your doctor regularly is probably one of the best things you can do for maintain your health. Mm-hmm. Yeah. Yeah,
definitely. Physical and mental.
100%.
Okay. Wonderful. So to recap here, Part A is for all the hospitals.
Correct.
Just try to remember it that way. Part B is the medical part of it. So
doctor's visits mostly. Correct, yes.
Okay. And then Medicare Part C.
Medicare Part C. So before we get to Medicare Part C, it'd
Okay.
probably be more advantageous to go to D. So let's skip
Oh,
over C
okay.
and go to D.
Okay.
So Part D now is prescription drug coverage, which, as we know, is super important to millions and millions of Americans.
Okay.
So, and that is separate from your Part A and your Part B. Part D costs. Part D costs a lot of money. So you hear people say like standalone prescription drug plan.
Right.
Yeah, so that's kind of like Part D. That's Part D. But it costs extra. So not only are you paying your Part B premiums, you now have to be paying for Part D as well. So to go back to C now, C is a combination of Part A, Part B, and Part D wrapped together in a very convenient package called either Part C or Medicare Advantage Plan. So when you watch those TV commercials and you hear, oh, Medicare Advantage Plan, call now. That's what a Medicare Advantage Plan is. So, and one of the biggest differentiators that most people should know, or should be aware of, is Medicare Advantage Plan is not offered by the federal government.
Oh.
So you would have companies like Aetna, not advertising for anybody, any Medicare carrier, most Medicare carriers, when they offer Medicare Advantage Plan or Medicare Part C, you don't pay for that separate prescription drug plan. They wrap it together in a single package for you. So you're still paying your Part B. But because instead of allowing the federal government now to manage your benefits and your health insurance, you say, hey, I want company XYZ, this Medicare carrier, to manage my Medicare plan, my Medicare Advantage Plan. So they wrap everything together, and you can only be enrolled in one at a time. So they manage your Part A, they manage your Part B, and they manage your Part D together. Okay. And those are available in both PPO and HMO. And I think we went over that briefly the last time. So if time allows today, we can go into that a little bit more as well. So yeah, that's pretty much it. So
Okay. Let's talk about cost for a moment. I know you said something about Medicare Part B and D costing.
correct.
So then A and C.
So A is you automatically get A as long as you put in your credits in the system.
And that costs you nothing.
It costs, well, other than what you've been putting into the system, yes. So there's nothing free. This is what Americans worked for and paid their dues. So, but yes, so Part A is you automatically become eligible for it. There's no additional charges for Part A, but there's definitely additional charge for Part B. For 2025, it's $185 a month for Part B.
Huh, okay.
And
Is that 185? Is that a month?
That's
year?
per month. That's per month.
Okay.
Yeah.
Okay.
And you have an option to either have it directly debited from your Social Security every month.
Oh.
No, sorry, not every month. 3 months at a time. There's other methods to pay it, but that's the most common method to pay it.
Okay. And the only way to avoid those charges is if that person has Medicare and Medicaid, correct?
That's one of the ways, but the other way would be to not enroll in Part B. But as you know, if you do decide to enroll in Part B later, every year that you was eligible for it, that you did not enroll in it, they add a 10% increase on the cost for you eventually when you do. So some people, like, they work even after 65 and they get like really amazing insurance through their provider. But yes, if you're enrolled in Part B, the only way to not pay Part B is if you are Medicare and Medicaid, which is what we call a Medi-Medi or a dual or a DSNP, dual special needs program. Then the state Medicaid will cover the cost of the Part B for you.
Which is great, and a lot of our seniors need that.
Especially in the mental health space.
Right. What about vision and dental?
So you keep bringing good questions. So traditional Medicare by the government does not include any form of dental visits, chiropractor, vision. There's no benefits there. And that's one of the things that you do get with most Medicare Advantage plans. They will include some kind of allowance for dental, for vision, for hearing aid, and none of these are covered by traditional Medicare. So I would advise everybody to know what your needs are. And again, that's going to be a conversation that you're going to have with your Medicare advisor to advise you what is actually best for you, depending on what your needs are. If you're a very sick person, if you do frequent hospital visits, frequent doctor visits, if your eyes are bad, if your hearing is bad, if it's progressively getting worse, then a Medicare Advantage plan that truly becomes an advantage because it covers a lot of those costs and it makes it much easier on the patient itself. So, yeah.
Okay. That's a lot of information. It is, but
I'll try to make it simple.
You broke it down pretty well.
Yeah. So if you're a person that's relatively healthy, in your golden years, and you're relatively healthy, and you want the freedom of being able to see whatever doctor you want whenever you want, then you could even do like a PPO, Medicare Advantage plan, to where you still have the features of Medicare Advantage and the low cost, and you can still see whatever doctor you want for the most part. And then some people choose just to forego Medicare Advantage altogether and stick with traditional Part A and Part B, and if they're not very sickly. But I'm an advocate for Medicare Advantage, though. Absolutely.
Well, like you were saying, it is very important to make sure that you get a licensed Medicare advisor. You know.
Yep. To go over your needs with you and do a needs analysis to see which plan was best for you. And that's a good part. There's many plans. There's many options. So, again, work with a licensed professional Medicare advisor for sure.
Right. Right.
And be careful who you trust and who you're seeking. That's why it's important that now you reach out to us or reach out to serious organizations that
Absolutely.
they're reliable and trustworthy, because unfortunately there's a lot of people that can say, I can help you, but in reality, sometimes they might not give you the best option
Or
for
have
your
your best interest
specific
at heart.
needs.
Right.
Yeah.
Yeah. And, there is a business side to this, of course. There is a commission structure to Medicare Advantage. So, Leslie, you made an excellent point. So, yeah, absolutely. Make sure you get someone who you feel comfortable with, someone who was highly recommended by someone else that you trust, to make sure that they're looking out for your best interests and not just their own, for sure.
That's very important. So it really sounds like Medicare can be definitely life changing, especially for older than 65 and older.
And not just 65 and older, disabled, mentally challenged. There's a lot of young people who actually do qualify for Medicare because of certain health conditions. And there's a big misconception that you have to be 65, and that's not the case. In fact, one of my clients is about the same age as me.
Oh, okay.
Yeah, and
you're a young'un.
Yeah,
Okay.
don't always feel that way, but yes, definitely like to think of myself on the younger side.
You are.
Thank you.
Let me ask you another question. We are dealing with a lot of veterans, people that serve in the military.
Yes.
And unfortunately, sometimes their insurance is very limited and doesn't cover all their necessities. And some people may qualify for Medicare because of the medical conditions. And I think that a lot of people don't know that there is a possibility for them to be able to qualify for Medicare. Can they do it even though, they have VA? Is there a limitation to only veterans use VA?
So it's funny that you mentioned the VA, because there are some VA benefits, and this is where you really, really, really need somebody who knows what they're doing, who knows Medicare, that knows VA benefits, because if there are certain VA benefits that if a veteran is enrolled in these VA benefits and someone enrolls them in the wrong Medicare plan, it could negate their benefits and make it really difficult for them to ever get it back again. And in most cases, they don't ever get it back. But there are plans that are made to be compatible with VA benefits as well, that acts as a supplement towards it. So again, making sure you're working with a licensed and knowledgeable, highly regarded Medicare advisor is the best thing.
Oh.
Yeah, it's very, very important that we get someone to, like you said, have our best interest at heart. Do you know if there's any other programs or anything that someone could reach out to, within their community, if they, don't live around here or something?
As to reach out to regarding to what specifically?
If they have questions regarding the Medicare.
Oh, there are so many agencies. I wish I'd known you were going to ask me this, but there are so many agencies that do provide really, really good information. A lot of them are nonprofit. They have nothing to gain. You know what? Next time I will provide a list, or if we can put it on the website, I'll put a list on the website later. But there are definitely a lot of organizations out there that specialize in helping seniors or Medicare or Medicaid recipients to find all the resources in their communities. There's a lot of them.
Some of the other options, I was just thinking, some of the other options. So we do a lot with recovery, and you're talking about disabled, or and we talked about a little bit about housing. Does Medicare cover long-term housing for those who are in recovery and who are disabled?
That is a fantastic question. Give me a second.
It's just a question, you know.
For people in recovery, yes.
Yeah.
If they have Medicare, then yes, absolutely.
Okay.
Again, reach out to a licensed advisor. And I know that there's even case management as well. So
there you go.
So if you're, especially if you're with a Medicare Advantage plan, and you call the Medicare Advantage, your Medicare Advantage plan provider, and you tell them that, hey, this is what it is. They actually have workers and caseworkers and case managers and a whole resource center that you can call, and they will provide you with all the different resources that's available in your area, at least the ones that they know about for sure.
And you can always go on, Medicare.gov?
Medicare.gov is another source too. But I would advise you to reach out to your Medicare advisor. Yeah, I mean, not your Medicare advisor, your Medicare plan.
Okay.
Your carrier, yes.
And Anthony, you'll put something on the website as well? Awesome. He said yes. Gave me a thumbs up.
There's something that I had wanted to mention as far as like a real life story.
Yeah, please.
So my client, who I tell you about, the same age as me, she is let's just say a mental health patient. There's no way she would be able to afford all her medications without Medicare and Medicaid, even though she's close to my age. She takes currently the market value for the medication that she take every single month is it comes up to about $250,000 a year of medication, and different doctors and different counselors that she sees. She sees several different mental health professionals, and she finally feels like she has a balance to where she finds the right amount of medications and doctors and therapy that works for her. So these are the kind of things that I think is like super important, that mental health patients know what's available to them and advocate for themselves. So yeah, even if you're not 65, there's definitely help available through Medicare and Medicaid. Yeah, just wanted to share that part.
Wow, thanks for sharing. That is definitely a story. I'm glad that the government's able to help her with that. That's a lot of money.
That's a lot of money.
Yeah, you guys didn't see it, obviously, but my mouth was hanging open.
Yeah. I mean, prescription drugs can get really, really expensive. So that's why, again, you want to make sure that you're on the right plan. You definitely want to make sure you're on the right plan. And even in her situation where she does feel stable, it's difficult for her to keep a job, get a job, or keep a job. So then there's I made sure that I put her on a plan that also provided her with a grocery card, so that she can get groceries, so she's not as much of a strain to her parents that she lives with as well. And these are like super important things. So
speaking,
how long is this process?
Which process?
When people that are applying for Medicare when they are young and they don't qualify for age, when they qualify for medical necessity.
As far as Medicare is concerned, it's even when you're young, it's relatively quick. It can be like anywhere from like 3 to 6 months. It's relatively quick as long as you have your doctor's notes and your diagnoses and disability. As long as all your paperwork is together and you submit it to Medicare, it's not a very long process to be to be approved for Medicare.
I encounter some patients that they were rejected the first time, and their medical provider recommended to seek legal advice. I mean, is that common?
That is very common, actually. That's very, very common. Someone there may have determined that I don't think this person is disabled. Now, if the patient just gives up and walk away, then. But when the patient says, "No, I have a right to this," unfortunately, sometimes you do have to fight for your rights. Right. So yeah, and it is a process for sure. Because keep in mind that Medicare is an insurance. It's maybe a government-run or government insurance, health insurance, but it is insurance at the end of the day. So they have a right to approve or deny claims. So
right. You just mentioned something about a food card,
Yes.
and that also reminded me with the Medicare, don't they also get a certain amount, like just example, $50 or something at maybe CVS to use over the counter? Are there other examples for that?
Not with traditional Medicare. You would get that with, like, depending on the Medicare Advantage plan that you go with, the carrier you go with, and whatever plan that you go on. Some plans offer it, some plans don't. Some plans offer a lot, some plans offer a little. It just depends. Some do offer an over-the-counter card for things like aspirin, which is not covered, is not prescription drug, or Bayer back cream or something like that, or even toothbrush, because these things will affect our health.
Right.
So a lot of programs do have an over-the-counter card, and then you have some plans that offer even a card that you can buy groceries with. You can pay your electricity with. You can pay your water with, your rent, as long as the company that you pay your rent to, as long as they're registered in the program, they can use that card to even pay a portion of their rent, their cell phone bill, any utilities,
Wow, so informative. That's a lot. Medicare offers so much more than I ever could have imagined.
Well, it's important to differentiate between Medicare and a Medicare Advantage plan, a traditional
That's
Medicare
true.
and Medicare Advantage plan,
And the Medicare Advantage plan is the C?
Part C,
Part
yes.
C.
Combination of Part A, Part B, and Part D.
D.
Yeah, Medicare Advantage.
That's great. Leslie, did you have any questions for Horatio?
No, actually, I think that people need to understand also the difference between Medicare and Medicaid,
Okay.
because a lot of people gets confused
Okay.
with Medicaid and Medicare.
Okay. So we covered a lot about Medicare for today. So if we want to jump into Medicaid, we could do that as well. So last time, I had mentioned that Medicaid is, unlike the federal government, which runs Medicare, Medicaid is run by the state, whatever state you happen to be in. It covers mostly low-income families and low-income patients. So, for instance, you don't necessarily have to be like on the lower socioeconomic end of the ladder. For instance, if you have a regular job and you make, what you consider to be good or decent money, you could provide for yourself. But what happens if you get laid off and you're between jobs? What happens if, you had really amazing health coverage to your workplace, but because you no longer work there and you're in between jobs, like, what do you do? So Medicaid will definitely cover you in that scenario. Depends on your income for the past 3 months is mostly what they look for. And they also, it's how much money you have coming in versus how much money you have going out to help qualify. Or even if you get pregnant and you don't have health insurance, most of the times you'll be covered, depending on your income level. So, yeah.
How long does that process take to get
Oh, that one is quicker. That one normally takes about a month. And, if you have questions, they call you, they write you, they say, hey, we need a little bit more information, because their goal actually is to get whoever needs coverage as quickly as possible, because it could cost more in the long run if they don't have coverage. So.
And how often do they have to renew it?
Oh, that depends, because I have seen in cases where you have to renew every 3 months. I've seen cases where you renew yearly. I've seen cases to where they just automatically renew the recipient or for the next year automatically. So it just depends on what. I'm not quite sure.
So you really have to stay on top of that.
You really should. I've actually have clients who call me and say, hey, I went to the doctor. The doctor said, they're not taking it, that I no longer have insurance. And then they took out X amount of money out of my Social Security. And when I log into them, to their Medicaid profile online in my access, I go with them, have them log in, and we look. They sent them like 3 notices, advising them to, hey, your renewal is coming up. We need you to go. You can go online now and renew it, and they just ignore it. But unfortunately, when their benefits gets denied, that's when they reach out, and it takes time to put everything back together again and get them back on it again. But yes, please stay on top of it. It's super important to stay on top of it.
It takes time and it costs them money.
And it costs money. Yes, it definitely costs money. I have another client. Now, her parents are both on Medicare and Medicaid. Both her parents. The mom is suffering from Alzheimer's. So, her dad stays home and takes care of her mom, the sweetest couple. And they didn't know that they had to renew their Medicaid. And it hit both of their Social Security benefits that was coming in. And it was, when you're that age, you're on a fixed income. So you already planned and budgeted for everything. And now here goes like $600 missing out of your monthly Social Security deposit that's coming in, especially when you're a couple and that much money is missing from both of you. It's really gonna hurt. You're really gonna feel it. So, and this is one of the things that you've been advocating for, Leslie, to have a professional monitor, manage, help you with your Medicaid and your health insurance, because for some people it's just really, really difficult. To think of two seniors. So this is one of them perfect scenarios where I'm right there with you.
It's not only for the seniors.
No.
We are always supporting people with mental health challenges.
Mm-hmm.
And one of the biggest challenges since the beginning, we're mentioning that it is very difficult for somebody that has anxiety or depression to even get on the phone to try to renew their insurance coverage.
Absolutely.
Sometimes to even make their appointments. So now imagine trying to navigate all the healthcare system, or what plan works best for me. What am I doing? Or just all these questions, trying to renew their Medicaid. It's very challenging.
And it's a time-consuming process too.
Time consuming. So, Horatio, share with us. You don't get paid to help people.
I know.
From the person, like a lot of people were talking, do I have to pay you? What do I do? Because we have a lot of satisfied clients that they were able to get the help that they need and get the continued care because they were able to get the right insurance tailored for their specific needs. And sometimes they say, how much do we have to pay you? It's like,
so the funny thing is, I do get that question sometimes. So what I tell them is, when I'm coming over, do me a favor, get your wallet, get your checkbook, get your credit card, get a debit card, and put them somewhere else. Like put them in your room somewhere, leave them in the car, because me and you, we're not gonna talk money. You're never gonna have to pay me anything at all. My commission comes directly from the Medicare Advantage plan provider. Then it doesn't matter which one I put you with. It's regulated by the federal government. It's regulated by CMS, the Center for Medicare and Medicaid Services. They control exactly how much I get paid, and it's any advisor gets paid, and it's the same across the board. So it doesn't matter what company I put you with as a licensed Medicare advisor. It doesn't matter what carrier or plan I put you on. The compensation for me is the same. So what does that mean to my client? It means to my client that when I'm in front of you and I'm speaking with you and I'm trying to ascertain what plan would be best for you, I have your best interest at heart. I'm going to get paid the same regardless. So when I spend the time talking to you, it's for you. It's 100% for you. So, and I want to make sure that you're happy with your plan. I want to make sure that your plan covers all of your needs, and I want it to cover all of your doctors. Of course, I haven't found one plan yet that covers every prescription drug and every doctor that my client wants to see or or prefers to use. But we try to get as close as possible. So
the beauty of helping people and knowing and reaching out to you and being like For a Better Day Foundation, being the linkage to the service that they need when it comes to healthcare, it's because it's the way we empower our clients, because they are the one that make the choice. You give them the options. You have these options, this option, this option, this other option, and they're the one that decide what plan, what insurance carrier, whatever it is that is going to work for them. And this is what I really like, because I come across so many clients that they were put in plans that they thought that they had no other choice.
It does happen. It's sad, but it does happen, and it happens a lot. But when you're with me, when you're with us, rest assured that whatever we do is going to be in your best interest, and you're going to be along every step of the way. And only you can choose. And if you feel like someone is pressuring you into one plan over the other, then maybe tell them, give me some more time to think about it, or let me consult with my son, let me consult with my daughter, let me consult with my sister. And if they continue to push, then that person is not, for you, or not your person. You have to be comfortable. And if someone is offended or impatient with you, saying you need more time or you need to consult, family members or friends, then yeah, that's clearly a red flag. That's normally a red flag for sure.
And when they're meeting with their advisor, what type of documents or ID or things, what would they need to gather?
Another fantastic question. The only thing you probably need is your Medicare card. That's it. If we're going for Medicare, then you'd need your Medicare card that they send you in the mail. We'll need the Medicare number. Okay. And there is going to have your Part A date and your Part B date, as when you first became eligible for Part A and when you first became eligible for Part B. That's probably going to be what we need. And an ID, just to make sure that I really am in front of, who you say you are. Because the Medicare card obviously doesn't have a picture on it. So those would be the two things we need for Medicare. For Medicaid, government ID as well. If you have any kind of medical documents to say, hey, this happened to me, this is why I can't work or whatever, then yeah, those kind of things would definitely help with Medicaid. Your bills, not just your bills.
What about income? Proof of income.
Proof of income, yeah. Your last couple of paycheck stubs, that would definitely help, so they can see that, okay, this is what this person is making, or even your bank statements. A matter of fact, when you're completing an application for Medicaid and or EBT, they ask you for permission. They say, hey, do you consent to us requesting your information from your financial institution? I always tell them, say yes. Okay. I always say yes, like you have nothing to hide, say yes. Okay.
And I know that there are special enrollment periods. I just don't know what they are. What are those?
All right. So special enrollment periods are, as the name indicates, special. Like there is a condition that they've made an exception to allow someone to enroll outside of the normal annual enrollment period, which is once a year, which starts in October 15th. So a special enrollment period would be, I'm on a Medicare Advantage plan and I moved from Miami to Broward County. So now because the county in which I reside has changed and Medicare Advantage plans are offered county per county. So there's a different plan for every county. So now that I moved out of my original coverage area, so now I moved to Broward, that's a special enrollment period. They say we'll allow you to change to whatever plan you want. That's available to you. So that's a special enrollment period. Another special enrollment period would be like a FEMA, federal emergency. So if there's a hurricane or something like that, they would say, well, the time that you would have normally had to enroll in whatever plan during the annual enrollment period, and now you're given an extension because of this disaster, this natural disaster. Right. So as long as you lived in one of those areas that was affected by the hurricane, so it would have to be like a what's the term that they use? There's basically if the if there was a declared emergency in the area that you lived, then most of the time those Medicare companies, the Medicare carriers, will apply for an exemption to allow enrollment, well after the annual enrollment period. That's another special enrollment period. Another special enrollment period would be. Another special enrollment period would be. I'm gonna have to get back with you on that one because it's just not popping up in my head right now. I know there's another special enrollment period, and there's a few more, but we'll come back to that.
Yeah. Well, that's important to know that you're not. I don't want to say that you're not stuck. Like you're not just just out of you missed the enrollment period, so you're done for the year. You have other options. Yeah,
you have other options. So the other special enrollment period that just came back to me is the 5-star special enrollment period.
Ooh, what's that?
The 5-star. So if you're on a plan that you're, for whatever reason, you're not liking it, it's not working very well for you, for your medical needs, then normally you can't, unless you qualify for another one of the previous special enrollment period I'll talk about. Your other hope is that there are plans, if there's plans in your area from the year before that did so well that they received a 5-star rating, which is an average from, they interview people, CMS interviews certain people and say, hey, how do you like your plan? And the plan that they just receive the highest star ratings, the 5-star ratings, they get a special enrollment period. So I can jump off of any Medicare plan, any Medicare Advantage plan that I am on once per year. to jump onto a 5-star Medicare Advantage plan. So that's another special enrollment period.
Wow. Never heard of that one.
Yeah, that's a 5-star. Yeah. So that's it.
Wow. Now I have a question for you. It just came to mind because we live in South Florida. So
I like it here.
I love it here. Can undocumented immigrants qualify for Medicaid benefits?
Undocumented? No, not undocumented. In certain situations, I believe like certain immigrants can, like if there's been a declared emergency. What do you call that program for when like there's a natural disaster somewhere else and they allow them like temporary protective status?
What is it called?
Temporary protective status.
Temporary protective status. Okay.
Then you can get on Medicaid.
Okay. And how does that work for? We've talked about age. We've talked about all the different ways you can get the insurance. But how does it work for children and families? Because we've talked about individuals so far. Is there an option for children and
With
families?
Medicaid?
Yeah, with Medicaid.
Oh, absolutely. Children are more likely and quicker to get covered than adults for sure. As when you apply, children, for some reason, children are mostly always, as long as the parents don't make a certain amount of money, children get covered easily, especially in like a low income situation for sure. Okay. And mom and dad too, but again, it just depends on the situation, the scenario. And they do have certain criteria though. They want to see how much dad has made, how much mom has made. They want to see how many hours they've worked for the week on average to see if you're like underperforming or, just to make a guess to make sure that if they do award Medicare or Medicaid, or even EBT to that family, that this situation really is a situation to where they really did need it. And it's not just because somebody did not want to work.
And Medicaid, does that cost? I don't think, have we talked about
No, there is absolutely no cost with Medicaid other than the cost of the state and the tax-paying residents of Florida. There's no charge with that. And matter of fact, in most cases, there's not even a copay or a deductible when you visit the doctor. There's no everything is covered. Everything is covered, providing that the doctor that you go see or the facility that you go see is in network with Medicaid. Like they accept Medicaid.
Okay. What is an out-of-pocket cost?
Oh, okay. So let's jump around to it's cool. We could jump around.
You
out-of-pocket expense. That. Yeah.
Oh, okay.
Out-of-pocket expense. When you talk about Medicare, so if anything that you paid for health related, when it comes to like drugs,
okay.
That's an out-of-pocket expense. If you paid a copay, that's an out-of-pocket expense. If you paid a co-insurance, that's an out-of-pocket expense. So anything within your healthcare needs, within the context of insurance, anything that you paid out of pocket, it goes towards something called your out-of-pocket expense, and they keep track of this because some plans they say once you reach a certain amount of out-of-pocket expense, you don't pay anything else for the rest of the year.
Is that in comparison to a deductible or a co-insurance?
An deductible and a co-insurance is an out-of-pocket expense as well. So if you're a very sickly person and you're always in the doctor's office, you're always paying your co-pays, you're always paying prescriptions, even with the discount that you get through your insurance company, there's still like an out-of-pocket expense to pay for drugs. So everything you paid out of pocket, they keep track of it. And again, once it reaches to a certain amount, they say no more. We got you for the rest of the year. And I think that's a really good benefit for Medicare recipients because if you're seeing a doctor that much and you're getting that much drugs, like you really are sick, like you really do need the help, So that's one of the best benefits of going with a Medicare Advantage plan as well. They call it maximum out-of-pocket expense.
Oh, okay.
So once you hit that threshold, they say no more. We got you for the rest of the year.
Okay.
So no more co-insurance, no more co-pays, no more.
So it is like a deductible.
Yeah.
Okay. So if you have Medicare and Medicaid, does any of that help with that out-of-pocket expense?
So for someone who really needs Medicare and Medicaid, for someone who is sick, for someone who is low income. I hate to say low income, but for lack of a better word, low income. That is the best scenario for them, especially if you're low income because you're sick and you can't work or whatever the case is. That's the best scenario for and one of the reasons why I'm so happy and so grateful to be an American citizen, because when there is a system that provides Medicare and Medicaid for someone who truly needs it, they don't pay for doctor's visits, they don't pay for drugs, they don't pay for the federal and the federal government and state comes together and say, we got you because, you're in need, so it's one of the best things for someone who truly needs it. It's one of the best things. It's a miracle.
Yeah, that's very good to have. I have a question. I've heard of this Medicare donut hole.
Huh?
Oh, you laugh.
Because
is that the actual term?
That is that's what it's affectionately dubbed. But what they call that is the coverage gap. The coverage gap. Okay. So the reason why it's called a donut hole or a coverage gap is because in the beginning of the plan, when the beginning of the year when you're in a Medicare Advantage plan, there's co-insurance, there's co-pay, and then there is prescription drugs that you're paying for. The donut hole relates specifically to prescription drugs and only to prescription drugs. So what happens is they're covering most of the drugs for you in the beginning, and you're paying your copay with the drugs. But once you hit a certain threshold, they say, okay, you're spending a lot of money on drugs. So for the rest of the year, you're on your own. So that's where the gap begins, because now the insurance company is not helping you pay for your prescription drugs anymore. Oh. But the reason why, once you reach a certain amount of money that you paid out of your pocket in the coverage gap, they say, okay, cool. So in the beginning, we paid together. In the middle, the donut hole or the gap, you paid for yourself. But now that you reach this number, don't even worry about it. We will take over. You don't have to pay anything else for the rest of the year. So that's why it's called a donut hole.
Okay, so it's not as scary as it sounds.
Oh, it can be. It definitely can be. But they did away with the donut hole for 2025.
Oh, they did?
Yeah, they did away with the donut hole for 2025 for sure, yeah.
That's great.
That's a fantastic thing.
That's great.
That's a fantastic thing. Yeah, it definitely could be scary. Because that can bring some family to financial ruin. Again, remember my my client who was telling you about that she spends about she used about $250,000 worth of prescription drugs every year. That would be really scary if if she didn't have Medicaid as well from the state to help her with that gap. Yeah, that'd be scary. It can easily go into financial ruin.
Right. I mean, I wouldn't know. I wouldn't know what to do. I wouldn't be able to.
And some of these prescription drugs are so expensive, man.
Yeah, of course they are. Of course they are. Okay. So this was a lot of informative information. Is there anything else that you can share with us that could possibly help? My brain right now is thinking, okay, preventative. You said preventative at the beginning. Is there any preventative services that are covered under Medicare, since we're talking about Medicare, that we should 100% make sure we get on top of?
Almost all preventative services are covered. Almost all of them are covered with zero cost. So if you feel something, don't brush it off. Like, I'm from Jamaica. Like, I don't know if it's macho. I don't know what it is. But, like, something happens to us. Like, we don't ever want to go see the doctor. And it's bad. Like, we're doing better now. But don't be like that. Like, if you feel something, if anything is a concern, go get it checked out. It's better to err on the side of caution for sure. Especially if there's no cost to you. Almost all preventative services are no cost.
I'm so happy.
And it can save lives. Yeah.
Yeah, I'm so happy that I just thought, thank you. Thank you.
Please, yeah.
Something else, we were talking about age and things like that. What about caregivers? Caregivers or family members, are they able to help manage loved ones, manage their Medicare and even Medicaid accounts? And then how do they go about doing that?
Absolutely. It's not as difficult as you may think. When someone is enrolling into even Medicaid, they ask, is there someone helping you fill this out? Is there someone that you want to be able to have access to your benefits? Do you want someone to manage your money, like your benefits that when it comes, And of course, you have that right to say yes or no. And there's also power of attorney for people who didn't quite realize that the patient was slowly what's the word I'm looking for? Deteriorating. That's it. Declining, deteriorating. That's the one. Those are the ones. Yeah. To where it got to the point now where they're just not even like cognizant anymore. So now we have to go get power of attorney. And even in that situation, it's still difficult because now you have to be able to prove that they're not cognizant or they're not able to make their own decisions. But yes.
And how do you protect yourself from something like that? I mean, as sad as it is, if it is a caregiver or a family member, how do you protect yourself from something like that?
Protect yourself from?
So what I'm thinking is you're setting this in place, right? When you go through the application process. Say I set a caregiver in place for me, and someone else, a family member, notices that I'm declining, and maybe this person is taking advantage of me. Where would be the next step that they look for?
You know, it's a funny thing that you ask that question because elderly abuse is unfortunately a very real thing. And unfortunately, there are even family members who would take advantage of the elderly, take their benefits and everything, and don't even take care of them really. There are advocates, but sometimes one of the biggest issue, like what Leslie was mentioning earlier, is that they don't want to say anything, they don't want to do anything, because it's kind of hard to be an adult who's being taken advantage of, who's being bullied. Right. So I would say that if you see something, say something, because unfortunately, in a lot of these cases, the victim needs an advocate. So if you suspect that someone is being abused or taken advantage of, there are definitely agencies that you can report them to, and it's taken very, very seriously. And we'll post that up on the website as well.
Actually, we can actually make a topic because that's a different topic on its own from Medicare. Benefits Medicare and healthcare coverage is a different topic. So we can actually touch base of that specific abuse later on. Katrina and I took a certification class.
Nice.
Of how to identify, abuse.
Good.
So
congratulations, you two, and keep up the good work for sure. Like
with adult with disabilities, it's very painful and it's very sad that unfortunately something that is very real happens. It happens a lot more frequent than we think. Yeah,
I'm grateful that you two took the initiative to go get certified with this because it's a real need in our community. So kudos to you two. Congratulations.
Yeah, that's what made me just think of it.
But let's go back a little bit though. Because you asked something about families and caregivers. The state actually has a program to where they will pay a family member to take care of a Medicaid recipient. Oh. Yeah, to help, with their care, because hopefully the hope is that your family will actually take good care of you. And if it takes away time from them going to work or, other income, and it's taking good care of you, cooking, cleaning, helping you, showering, changing, using the bathroom and stuff like that. It's a real job. And a lot of the times it's, family members do help their loved ones. They do help their mom, their dad, their uncle, whatever, and take good care of them. And before there wasn't any compensation for it. Even if we were to hire a professional to come in and do the same thing, probably not even as good as a job as you would because you love your mom and your dad. Yeah. And hopefully you get lucky and the caregiver comes in is a great caregiver. And shout out to all the caregivers out there. You guys are doing, a very necessary job when it comes to taking care of the elderly or sick, handicapped. It's real hard work. So shout out to you guys. But in this case, with family members, absolutely. The state does have a program to pay family members to help take care of Medicaid recipients.
Amazing. I had no idea about that. You've been teaching us so much. Okay, Horatio, what advice would you give someone just starting out their Medicare or Medicaid journey?
As a recipient or as an advisor?
As a recipient.
As a recipient. Oh, God. Read, attend every Medicare event that's in your area, whether it be a sales event or whether it be an educational event. Ask many, 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 many questions because it's complex. It's a lot. It's very expansive. So ask a million questions. Ask as many questions as you can. speak to as many different people as you can until you find the person who you believe is your person. But yeah, man, just ask a lot of questions, because there's so many things that's covered and so many features to so many different Medicare Advantage plans that you won't even know exist. Like Silver Sneakers is a big one. So,
I've heard of that.
So
Yeah.
Silver Sneakers is any participating gym or fitness center that participates in the Silver Sneaker plans. You automatically have a free membership, a free basic membership. One of the many benefits that you wouldn't even know is that they will actually pay for an Apple Watch for you. Not because it's an Apple Watch, but because it can be used as a health and fitness tracker. So anything health related, a bicycle, bowling balls, anything that keeps you fit, anything that involves physical activity, golf clubs, like it will cover those. Most of the time you have to buy it first and then fill out a form, send in the receipt, say I bought this, and they will reimburse you for it. Some plans do up to $600 a year. So yeah, like ask a million questions. When you start off your Medicare journey, it's a golden time. It's a golden time, yeah, for sure.
Well, that's amazing. Wow. Knowledge is power.
100.
Really. Knowledge is power. Knowing your options, it definitely can lead to better care all around. Less stress.
Hopefully less stress for sure.
And a better day.
And a better day.
Absolutely. So be sure to check out this show and the notes that Anthony's going to put on the website. And I'm going to go back and listen to this. This was so much information. Thank you, Horatio.
My pleasure. Thank you guys for having me.
If anybody has a question or specific questions about this topic, just reach out to us. Send us your questions and we'll find the answers for you. Thank you.
Thank you.
Thank
Have a good
you.
evening.